So here on eNCA, we've been reporting extensively about how the third wave of COVID-19 has been testing our health system. The race is on to get people vaccinated. What's the status of the rollout? Are we going to get in front of the curve when it comes to the state of disaster that we are in Gauteng? Francois Venter from eNCA joins me now to talk about all of these issues. Thank you for your time, Francois. My first question is specifically about the Delta variant, which, as we heard a week or so ago, is primarily driving the increase in infections because it is more transmissible. But what I want to know is it more deadly? Do we have any new information about the Delta variant?
We don't have new information about them, about whether it's more deadly. I think important for your viewers to understand is that viruses have no inherent desire to kill you. It's just if a mutation happened that knocks you off, it's because that you were just unlucky. What they evolved to become is to be more and more transmissible, and that's what the Delta virus has done. It's outwitted the Alpha and the Beta and the other variants that we've seen. It's by far in a way the most transmissible one that we have at the moment. The data we do have is that this preliminary data show that that some of the symptoms are different. There's more of a snotty nose and a headache than there was the loss of taste and the loss of smell. But that's very preliminary data. Whether it's more lethal, we just don't know.
I don't want to be alarmist, but I have been reading in some reports, the BBC, the Guardian, various others, that this transmissibility issue is so problematic because initially there was conversation that if you were engaged in a 15-minute conversation maskless with the original virus, you could get infected. Now there's talk of very short interaction, two people walking on a street. That might just be alarmist. Can you give us any confidence around the airborne nature of this virus if it's different from the original one?
The sad reality is that is what we're going to be looking at. The previous advice around 15 minutes, 2 meters apart, has been a significant interaction, may well be shorter than that. It may be down to a few minutes at all. And there have been these isolated, scary reports of transmission from one person to another with much shorter interactions. As you say, there was a much reported case in Australia where people brushed against each other in the supermarket. It doesn't change the basic advice, which is avoid indoor gatherings, wear a mask where you're with people you don't know as much as humanly possible. I think we will probably see a tightening of that advice as we're going forward. And it may also mean that we start looking at higher quality masks being recommended to the public. I hope that data comes out in the next week because South Africans obviously desperately need it.
Let's understand the vaccination schedule. Now, obviously, we've seen a speeding up this week, far more people being vaccinated than were previously vaccinated. It looks like some of those supply constraints are no longer in place, which is all very positive news. None of that, though, helps during this particular wave. It might help later on. But give us an update on where we are with that and how it is of benefit.
So the numbers of people being vaccinated has accelerated over the last week. We're still only at less than half of what we need to be doing. And on weekends, vaccinations almost come to a grinding halt, which is inexplicable considering all our modeling and all the government planning is around it to continue on the weekends. But what has been good is that the supply constraints seem to have temporarily been have been swept away, and we have got sufficient vaccinations in the country, which is part of the reason why I think government has relaxed some of the criteria, dropping the criteria to 50-year-olds, opening it up to teachers and to journalists. It's something we're going to have to keep a beady eye on because we've been promised these vaccines on an almost weekly basis, and sometimes the suppliers have not met what's been promised. And if that supply line gets disrupted, our already very slow program is going to be even further disrupted. The good news we do have, though, is that the vaccines that are being used in the country are active against the Delta variant. All the vaccines are active against all the variants, which is wonderful news for those of us who have managed to get vaccinated.
Yes, but they don't immediately make you into superhuman or able to avoid infection, right? There is a delay between being jabbed, and I think it's important for people to realize this because they can't suddenly behave any differently, whether it's the Johnson & Johnson or the Pfizer jab that they've had. There is a time lag between getting the injection in the arm and being having better defense.
It's really important you make that point, actually, is that we're getting a lot of people saying, I got sick a week after or 3 days after having the jab. The vaccine takes a couple of weeks, preferably 2 to 3 weeks minimum, to start exerting some sort of benefits. And that benefit slowly accrues the longer that it's in your arm. So it's very important to people understand that you cannot run out and behave as normal when you've got your vaccine. You need to wait a few weeks. Now, that means that we could vaccinate the whole of South Africa tomorrow, and the third wave would still decimate us, as it is at the moment. The protection is just coming way too late. What we're doing now with the vaccination program is securing the people for the very tail end of the third wave, the in-between bit, and then what's widely anticipated to be the fourth wave, which is likely to arrive towards the end of November and December.
That's very sad news to hear. Let me get practical, continue to be practical about this. People are falling ill all over the country, but particularly in Gauteng. They are hearing from us and other media outlets that the hospitals are overwhelmed, that there are no beds available. So more and more of them are probably choosing to stay home and try and manage themselves. But there must be a point at which a person says, I've got to go to the hospital. What is that point right now if someone is infected and is COVID positive? At what point do they say, got to try and get to a hospital?
So there is this critical point, and I think as a practical way for people who are lucky enough to have a home SAT meter, if your SATs are persistently below 90%, you're heading into trouble. Sometimes there are all sorts of issues with how the probe sits on your finger or wherever you're taking it, and it can dip down and can actually alarm people, but it's important to take several readings. But if it's persistently going downhill and the person is feeling breathless or is experiencing confusion or anything in that line, or is behaving in a way that makes their family worry about them, rather get them to a health facility. The facilities are grossly overwhelmed at the moment, and it's a scary place to be. But there are contingency plans. The healthcare workers are quite experienced in identifying people who require a bed and who require ICU. They have access to the drugs. We still haven't had reports of outages there. So the best place to be when things are out of control is to get yourself to a facility, anticipating it's not going to be an easy process. It is a very scary time at the moment, and I'm afraid because the numbers in Gauteng in particular, but also in the Western Cape and in Mpumalanga at this stage, and possibly even the other provinces are shooting up, the healthcare facilities are going to get hammered over the next few weeks. So things, unfortunately, particularly in Gauteng, are going to get a lot worse before they get better. But there is a point at which the only thing that's going to really make a difference is going to be oxygen and steroids, and that you're going to get in a hospital facility.
Thank you very much for your time, as usual. Francois Venter, Professor of Medicine from eNCA.